I am Professor Dr. Ashraf Zaman, Professor of Biochemistry. Today I shall discuss with you about bilirubin metabolism. Bilirubin comes basically from the hemoglobin. 85% of bilirubin comes actually from hemoglobin. You know the lifespan of RBC is 120 days. So, after passing the RBC in the circulation for about 120 days, when it will enter into the reticuloendothelial system, it becomes destroyed or ruptured and hemoglobin comes out. So, this hemoglobin is now separated into two parts. One is your globin, another is hem portion. So, the maximum bilirubin, around 85%, comes from the RBC, and the remaining 15% comes from cytochromes, peroxidase, myoglobin, and catalase. So, now what happens with the hem? Hem undergoes in its own way that microsomal oxygenase system enzyme process under the presence of NADPH and oxygen. It is being converted to bilirubin by the breaking down of the porphyrin ring, which is ring shaped, but the biliverdin is linear. The change linear is the straight line chain. So, this biliverdin is green in color. Biliverdin is green in color. Now, biliverdin reductase converts the biliverdin to orange colored bilirubin. This bilirubin is basically slightly soluble with the plasma. So, it becomes non-covalently attached with the albumin, and it enters into the liver, and the albumin, which was covalently bound, it is now separated from the bilirubin. Now, under the facilitated diffusion, the bilirubin enters into the hepatocyte, where it is being conjugated with the uridine diphosphate glucuronic acid. Two molecules of glucuronic acid is there. Two molecules of glucuronic acid binds with the bilirubin. Bilirubin now becomes conjugated. This process is very important for the bilirubin metabolism, because conjugation, without conjugation, it cannot pass with the bile canaliculi and the bile duct, and ultimately into the intestine or the gut flora. After the uridine bilirubin diglucuronide is formed, after conjugation by the concentration gradient, it comes out from the hepatocyte to the bile canaliculi, and from the bile canaliculi it goes to the bile duct and enters into the intestine. There, this conjugated bilirubin is now hydrolyzed. And this is being reduced by the gut flora and converts urobilinogen. This urobilinogen is colorless compound. When it again goes through the gut, then it is being converted to stercobilinogen, that is by the gut flora it is oxidized. It is being oxidized, and stercobilinogen is converted to stercobilin, which gives the normal color or the brown color of the stool. But all the urobilinogen that is formed is not excreted through this way. Some of the urobilinogens again goes back to the liver, and there is also again hepatorenal circulation, and from the liver it again goes to the kidney, and it enters into the urinary system, and urobilinogen in this time is converted to urobilin, which is excreted out through the urinary system, and it is the slightly yellow in color. That is why the color of the urine is yellowish in normally. So, bilirubin, which was started as from the hemoglobin particularly, is now metabolized into two forms. One is stercobilin, which is excreted from the body with the stool, and another is urobilin, which is being excreted out through the urine. And the color of the stool is responsible for the stercobilin, and color of the urine is responsible for urobilin. The normal range of serum bilirubin total is in SI unit is 3 to 17 micromole per liter, and in traditional unit is 0.2 to 1 milligram per deciliter. If due to any reason in the body fluid it goes more than this range, then the yellow coloration of the sclera, mucous membrane and skin becomes yellow in color, and subsequently the sign which we call it jaundice. Jaundice is of three types. One is hemolytic jaundice, another is hepatocellular jaundice, and another is the obstructive jaundice. So, hemolytic jaundice is because of increased RBC breakdown and hemoglobinopathies, mismatched blood transfusion. In this case, in the hemolytic jaundice, we find mild increase of bilirubin, that is around not more than 5 milligram per deciliter. But there will be presence of reticulocytosis, because many of the hemolytic jaundice occurs after the birth of the baby, because at that time a increased number of RBC broken down, and this is being liver is not ready to receive them, because uridine diphosphate glucuronic acid, which is not ready to receive it, and the liver is not mature enough for conjugation. So, the bilirubin level increases, and this type of jaundice is termed as hemolytic jaundice. We will search for the presence of reticulocytes, and there may be mild anemia, and the lactate dehydrogenase and the AST may be elevated. In case of hepatocellular jaundice, this is the most common jaundice which we come across in our day-to-day life, and this is due to the viral hepatitis. The viral hepatitis are the hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis E virus, and D virus. Hepatitis E virus is most common because it enters into the orally, and unhygienic our tradition to take food in the restaurant or anywhere else. So, it becomes orally infected with the hepatitis E virus, but hepatitis B virus is transmitted through blood, sexually transmitted, and it is directly through the transmission. It is not that orally hepatitis B virus cannot be transmitted. And in respect to hepatitis C virus, there is associated other disease like renal failure, where the patient is under hemodialysis. In this case, the single test for hepatocellular jaundice, where the hepatocytes are distorted, the structure is damaged, there the alkaline transaminase, there is the ALT will be increased maximum. So, if asked that what is the single test for the liver disease, this is ALT or alanine aminotransferase. Now, in relation to obstructive jaundice, the most common is the carcinoma head of the pancreas and the gallstones in the bile canaliculi. For this, the test is the alkaline phosphatase, and there will be progressive jaundice. There will be more and more severe jaundice gradually and progressively. So, this is the way how bilirubin is metabolized, and if there is increase of bilirubin in the body fluid, the subsequent result is jaundice. So, the in case of hepatocellular jaundice, in case of bilirubin metabolism and jaundice, we have to look for the enzymes. The enzymes are for the hepatocellular jaundice is the alanine aminotransferase, that is the ALT is most important, and for obstructive jaundice alkaline phosphatase is most important. With this we conclude today's lecture. If there is any question, you can ask today or in the next classes also, or in your message or by any means. Thank you today. Let's Allah Hafiz. We'll see you again in the next class.